that is exactly how I felt when I found out we were going to placement. And at that point in time, we'd only been in university for about 4 to 6 weeks, and the only thing I knew how to do was to make a bed. So obviously, I was freaking out like, okay, so we're going to placement. I don't know how to do anything. How is this going to work? And I'm pretty sure you're also feeling this way. So in this video, I'm going to be giving you tips on the things that you can do before, during, and after placement to just help you fit in the first few days and first few weeks of your placement. Please note that this is from the point of view of how my year level worked out and how it works at my university. Obviously, if you're in a different province or if you're in a different country, it might work differently, but the principles remain the same and the advice will still apply to you. Let's get into this video. So at this point in time, all you know is that you're starting placement, you know the starting date, and you know the hospital and the ward that you're working in. So it's time for you to do research. So you need to research that hospital itself to just find out where it is, especially if you're going to be traveling with public transport. You need to be able to know how to get there early in the morning and late in the evening. You also need to find out if that place has public transport should you be working over the weekend. This is mostly for students that are working in a hospital setting. Once you have found out how to get to the hospital placement, you also need to find out the times that you guys will be working. If you're working in a clinic, from our university it's 7:30 to 4:30 or 7 to 4 o'clock. And then if you are in a hospital setting, you're starting work at 7 o'clock to 7 p.m. Obviously, at those different facilities, you need to be there at least 30 minutes before and sometimes even 30 minutes after. So you just need to be aware of those things, because obviously 30 minutes before so that you can be part of handover. And sometimes you might have an emergency later on during the day and you need to stay after. So whatever transport arrangement that you're going to be making, you need to make sure that it's going to be available during those times. So once you've figured out how to get the placement, you need to do some research to find out what type of patients you can expect to find in the ward that you're going to be working in. This you can usually find it on the hospital or the clinic website. If you're in a clinic, obviously you just need to find out, are you dealing with kids, are you dealing with adults? And at the clinic you can expect everyone and everything, but in a hospital setting it's a little different and it's a bit more specialized. So in a hospital you need to find out if it's a medical ward, a surgical ward, a trauma unit, emergency, oncology, etc, etc. So there's different specialties that you could be working in a hospital. So you need to do research. You can Google the hospital itself, or you can ask past students to try to find out what type of ward you're getting yourself into, and this will give you an idea of what type of patients that you're going to be dealing with, so you sort of know what to be expected of you. Another thing that you can do before placement is you need to learn your vital signs. This, you need to know the normal ranges for your temperature, pulse, respiration, and blood pressure. You can also learn of your HB and your AGT, but the first four are the most important, because in your first year you're going to be focusing on those a lot, and majority of the time they're going to tell students that in their first year to be checking the vital signs. You'll be doing that majority of your first year, so you need to know what the normal ranges are, what are the danger signs. And with the normal ranges, if someone is hypertensive or they've got high blood pressure, you need to know what their normal values are if they're hypertensive, and for someone who is not, and what to do in case of an emergency, etc, etc. So those are the things that you can start learning before placement. Obviously, if you have started learning skills in your skills lab, you need to refresh on those because you're going to be doing them often. In our first year, the things that we learned was how to make a bed, how to fold it, and then obviously we learned how to discard of bodily fluids, of how to discard linen, where does it go, etc. So just those basic things that you have started learning in your classes, you need to refresh on those so that you at least have some knowledge that you're taking with you on your first day. Next important thing is you need to get your uniform together. In your first year, they're going to nail you on your uniform. They want it to be top notch. So I have made a video already on the nursing uniform that you need to have. I'll link it over here. But please make sure that it's the right uniform. At my university, usually a week before, they'll ask students to come in their uniform at skills lab so they can just check your uniform. Please ask your supervisors and your lecturers if your uniform is correct and get all the stuff that is still missing. But the most important things you need on your uniform, obviously everything is important, but the two main things is your epaulets. These tell the people that you're going to be working around that you're a student and what year level you are, because everyone needs to know what type of rank you are. Obviously, this will determine the things that you can do, and you need to be identifiable among every staff member that is there. Another thing is you need to have comfortable shoes, especially if you're working in a hospital. You're going to be working 7 to 7. You're going to be standing the whole day, walking around, sometimes even running. So you need to make sure that your shoes are comfortable and they're going to last you the whole day. If you're in a clinic, it's a bit more relaxed because majority of the time you're sitting and there's not a lot of standing that's happening. But please make sure that your shoes are proper. And in the hospital, you're going to have matrons working around. The nurses that you're going to be with, they're going to be new on shoes. So make sure that you have the correct nursing shoes, but they must also be comfortable. Another thing that's very important is your name tag. This can either be your student card that you attach to a lanyard that's attached to either the shirt or the pocket. Please do not have lanyards that go around your neck, because this is going to be a hazard for you. In case you're leaning forward, a patient may grab on it, it might get stuck on something, and it just will distract you. So please make sure that it's one that's actually detachable and can just attach to your pocket. Please make sure that you have your identification badge, because whoever you're going to be treating, they need to be able to see your name and what university you are from. It is part of requirements as a student and as a health professional for you to be identified by your name. In addition to this, please make sure that whoever you speak to, you greet them and say, "Hi, I'm student nurse Silvaso Mperiki. I'm a first year nursing student from the University of the Western Cape." They need to know that information, especially when you're answering phone calls, etc., etc. But obviously this has been explained to you, so you need to know the importance of you having those identification badges. After getting your uniform, you need to get your equipment. So there's few basic things that you need. Obviously, I spoke about this in the nursing essentials video that I've already mentioned, but the most important things that you need to have is black pens. Have multiple black pens, and should you borrow someone your black pen, please make sure you ask for it back or you stand by that person as they use your black pen, because black pens get missing all the time, whether you're working in a clinic or in a hospital, because everyone uses black pen. So if someone sees a pen, they'll take it, they'll use it, forget about it, and they'll walk out. So have multiple black pens. Second thing is you need a scissors and you need a thermometer. Those are things that you're going to be using regularly. And then also you need a notebook. This notebook will be your lifesaver. In that notebook, you can write your vital signs, and you also use it to write things that you need to do for patients. If a doctor tells you something, so that you do not forget. If you learn about a new medication, about a condition, anything that you learn in the hospital that you need to remember for a later time, or just something that you found interesting, you can use that book to write all those things in. Another thing you need to have is you need to have a watch. This can either be an analog one, the one where it's a digital one, but it must still have the seconds counting, or you can have a normal watch that has a second hand watch that has the second hand in it, because you will need it when you're counting respirations and your pulse. Another thing that you need is obviously your clinical book where they sign your timesheets, and also you can have your module guides. Should you have a procedure or you want to practice your procedure, you need to have your module guide so that you can use it to reference. And also if you need to have any clinical competencies signed, you need to have it with you so that you can get it signed. And then all of these things, you can either find a small pencil case or even a toiletry bag where you can keep all your equipment with you so that it doesn't mix with other things at home, because obviously a hospital is very dirty. Yes, you might sanitize it, but it's just preferable if you can separate your home stationery or your school stationery with your work stuff. So make sure that you at least have double of both so that those things are not mixing. Have a good bag with you so that you're able to carry your books with you and also your lunch with you. And then coming to your lunch, please make sure you're packing your lunch the day before. And the reason why I say you must pack your lunch, yes, some people they do go out and buy lunch, but it becomes very expensive for you, and you're more likely to buy unhealthy food because I don't know what it is about hospital. Hospital, we are telling people to eat healthy, you must eat your vegetables, etc., etc. But the food that is available at the cafeterias are so unhealthy. So please make sure that you're packing food for yourself, and it will be enough for you for the day, because it is a 12-hour shift and you only get 2 breaks, which is a half an hour break in the morning and then sometimes an hour and a half or 2 hours break during lunchtime. Every ward works differently, so obviously just ask about those later on. In addition to the whole food scenario, you're gonna have to learn to control your natural tendencies, if I may put it in that way. You're drinking water, you're not gonna have time to be sipping water during the whole day. So when you have your lunch, you need to make sure that you're gulping like half of your bottle of water. And also during your tea time, that's when you're peeing. You will have time to pee during the day, but because it gets so busy, whether it's in the hospital or in the clinic, sometimes you actually forget that you need to pee until you're really pressed. So you need to be able to control when you will have your water and when you will have your pee, and make sure you're at least doing it during your pee break so that it does not affect the flow of your workday. Also, while you're busy packing your lunch, make sure that you're packing your bag. You don't want to forget anything at home, especially your watch and your pens and your clinical book. You need to make sure that you have everything ready for you, and you can even put it by your door so that you do not forget it, because it gets really frustrating when you get to the hospital or to the clinic and you're like, darn it, I forgot my scissors. It just makes you look really unorganized, and you're constantly having to borrow things from people. It just really delays things, and it's just very unprofessional in my own opinion. So please make sure that you're packing your stuff so that you have everything together. Another thing, please make sure that you're going to bed early. You also need to calculate how much time it takes you to get to the placement that you're going to, what time you wake up. This will determine the time that you need to sleep. Usually 9 o'clock, 8:30 is a good time to get to bed, because you need to be very well rested. It's going to be a really long day, especially the very first day you go into placement. So you need to make sure that you are properly rested, and so that you be alert and awake so that you can take everything in, because the first day is going to be information overload. So you need to be fully awake and aware about everything that is going to be going on around you. So please make sure that you're sleeping early. So these are all preparations and things that you need to get yourself sorted out before placement. Obviously, you need to get yourself into the correct mindset. You must go into your clinical placement and be willing to be taught and learn. Have a good attitude when you're going in. So those are the things that you can prepare before you get into placement. Now, let us get into what you need to do on the actual first day and the days going forward.